I'd like to welcome you to the webinar on social prescribing and community civic engagement. And this is funded by the Erasmus Plus programme. And I'm Joyce Kenkry, Emerita Professor of Primary Care and Chair of the WONCA Special Interest Group on Social Prescribing and Community Orientation. And I'd like to present my co-presenters, Ferdinando Petrozzoli.
Yes.
Who's going to introduce himself?
Yes. My name is Ferdinando Petrazzoli. I'm a genuine practicing GP living and working in southern Italy. I'm also the president of EURIPA. EURIPA is the European Rural and Isolated Practitioners Association, which is also a network of WONCA Europe. And I'm happy to contribute to this webinar. Of course, I'm a member also of this social prescribing and community orientation special interest group, which is a special interest group under the umbrella of WONCA Europe.
And Juan?
Hello, everyone. My name, and thank you, Joyce. And thank you for the invitation to be here with all of you. My name is Juan Mendive. I'm a family physician working in an academic practice in the outskirts of Barcelona in a deprived area. I've been in this area for many years. And I'm also part of the social prescribing and community orientation special interest group of WONCA Europe. And I'm participating in the SPACE project as part of the group that is providing research on Barcelona. We have a research team. It's called IDEA Jordi Gol in Barcelona, and we are part of this network on the space. So we're going to present how the project is going on and how you enjoy it. Thank you.
Thank you. So I'd like to mention beforehand that before we start, at the end of the webinar, we'll take a photograph. And if you don't want yours to be taken, please turn off your camera at the end. So I'm going to start to share my presentation. Just like to start by saying that this is a project brought together, led by the Centre of European Volunteering. And what is, I think, special about this partnership is, in actual fact, 5 of the partners are from volunteering agencies. So it's led by the Centre for European Volunteering, led by Gabriella Civico. And within the partnership is Volunteering Ireland, WONCA Association, Heaton Mersey Conservation Group, Hellenic Cancer Federation, European Platform for Rehabilitation, Malta Council for Voluntary Sector, and the Research Institute of IDEAP in Spain. So the project objectives is the project was developed with the aim of building capacities in health and voluntary sectors to offer social prescribing in urban gardens. Based on research and our own observations, social prescribing can be a useful tool in a holistic approach to rehabilitation, particularly in the context of recovering from cancer. So the objectives is to co-produce with interested stakeholders a suitable approach for implementing and integrating volunteering as part of social prescribing. Also to raise the capacity and confidence of health, social care, rehabilitation professionals, as well as civic society organisations and non-government organisation staff and volunteers to engage with social prescribing programme in the context of volunteering. And also to increase the interest and awareness of the value of volunteering in urban and community gardens as part of social prescribing schemes, especially for people recovering from cancer. So the activities within this research project is to start off, first of all, by doing some desk research on the current situation of social prescribing across Europe. not only looking at the literature, but also focus groups and with stakeholders. And Ferdinando is going to present some of these results, as well as Juan Mendiv, but also going on to develop and pilot initial training materials for health, social care and rehabilitation practitioners and volunteer managers, but then go on to develop a space quality label for organisational criteria for the Space Awards, giving recognition, implementation of social prescribing. And then finally, to actually, with dissemination, is run 5 community practice events, 5 local sustainability events, and an international conference. So it's really trying to think from, first of all, getting the information beforehand from across Europe, but also to think about training, but also dissemination. So the desktop research at the beginning was to gain an understanding of social prescribing through volunteering across Europe, especially in green spaces, community gardens and city farms, especially for people recovering from cancer, but also to establish a basis for a common approach to social prescribing involving volunteering. So we initially started off with a scoping review of the literature on social prescribing and cancer rehabilitation. But also we went on to actually cover focus groups to actually talk about what's happening in different countries across Europe. But also through WONCA, ran a European survey of 1,500 practitioners, and finally create a state-of-the-art report, which was submitted at the end of June. So this project actually started in January, and there's been a lot achieved over a very short time, from engaging at a national level, but also across internationally, running European focus groups. So the next stage, which Juan mentioned, is the developing and piloting of training materials to provide a comprehensive approach for training all the organisations, but also testing the materials by involving 125 cancer patients, 30 health and social care and rehabilitation professionals, civic society organisations and volunteers, 10 health and social care, rehabilitation and volunteering organisations in 5 different countries. But most importantly, to prepare a policy brief aimed at education and training, civic engagement, EU values and health policymakers. So it's really then not only taking it through to training, but also to evaluate that training to see, does it work? Does it make a difference to the health and well-being of patients recovering from cancer? So last of all is thinking from communication and dissemination, is thinking about advocacy and sustainability throughout the duration of the project, is having initial midterm face-to-face meetings, involving partners and additional interested stakeholders at all stages, but also at the International Policy Conference for interested parties such as member state policymakers and their representatives, and also related ministries. And it's also dissemination through traditional and social media channels, constant review and iteration of training materials, and also having wide access to these materials and the results from the training. So I'm going to hand over to Ferdinando, who's going to tell you some of the results.
Okay, thank you very much, Joyce. And okay, let me find my presentation. Okay, so my presentation is regards the 2 important deliverable of this working package 2 of this project, the scoping review and also the focus groups. So regarding the scoping review, as you will remember, we were interested in finding literature which deals with the usage of social prescribing in people affected by cancer, but especially, you will remember, in the rehabilitation phase of cancer, not in those who unfortunately have, let's say, not a bad outcome. So the methodology. So we searched in 3 different databases: Scopus, PubMed, and PsychoInfo. And we searched till March 2025. And especially, we focused on the cancer rehabilitation from cancer. The first question was quite broad, so we found over 122,000 citations screened. 60 studies were reviewed, and in the end, just 32 interventions were included. You will remember that we also were very interested in the green activity of social prescribing. Actually, we are also interested in the blue activities, where activity at the seaside, but we found very little about these other activities. So the intervention reviewed gardening, which proved to be to improve physical activity and nutrition; nature-based activity, which proved to enhance mental health and mindfulness; physical activities, for example, north walking and community exercise programs. We also found creative interventions where art was used also to express emotional processing, peer support to reduce isolation and to improve coping skills, and yoga as well. So the challenges that we've found in these articles: the lack of resources and the idea that in the future these resources could improve. Not always we have found this optimism. The lack of long-term follow-up in these studies, and above all, the overrepresentation of breast cancer survivors, which after all is quite, we could expect the results, because this is a kind of cancer where we expect a possibility of rehabilitation. So what are the strengths? Positive impacts on psychological well-being, social connectedness, coping mechanisms, and of course, promoting physical health and healthy behavior. Recommendations that we've found from this scoping review: develop standardized protocols for interventions, provide competency-based training tailored to cancer patients, and emphasize cultural competence and ethical. And we also conducted 2 focus groups, one on May the 13th and the other one on the 19th of May. The participants were healthcare professionals, researchers, and project coordinators from 14 countries. This was for the first focus group. The secondary was mainly based on people who work in the voluntary sectors. So the objective was to explore challenges and opportunities in social prescribing across Europe. These were the people involved in the first focus group. So if you look at the current state, we have found out that in UK and Ireland, social prescribing is the place where it is most developed. It is really integrated into the national framework, while unfortunately in the other countries still are lagging behind UK and Ireland. Regarding Portugal and Italy, for example, there are a lot of pilot initiatives in primary cares and municipalities, but as single initiatives. Other countries also present a fragmented activity of social prescribing with unstructured efforts, Romania, Turkey, and Germany. And what are the barriers? The barriers, as you can expect, is lack of funding, lack of also specialized workforce, the education of the team, coordination, and systemic support. So there is a need of good trained personnel. The key gaps are no standardized qualification for the so-called link workers, limited awareness among healthcare professionals. This is also very common, except the UK and Ireland. The training content, we need to improve the stress management, motivational interviewing. These are all the skills that we require for the personnel involved in the social prescribing. Health literacy, suicide awareness, safeguarding, and we also need a multidisciplinary approach for holistic implementation. Examples in Ireland, there are peer networks for link workers, while in Austria, they struggle to establish educational program on the topic. There are also cultural, political, and legal barriers that challenge us, a lack of system support, sustainably finding policy frameworks. There is resistance to the zero mindset and time constraints. For example, me as a GP will also have limited time for our consultations with patients, and it's difficult to act as case finding to find out which person would benefit from social prescribing. We need a cultural shifts impacting community structures. For example, we need to take into account the migration towards the urban country and people living in rural settings, living alone, the family dynamics, etc. What are the opportunities? Promote collaboration between health and social sectors and engage policymakers to establish legal frameworks. Regarding the second focus groups, where most of the participants were from the voluntary sectors, the key role is to lead grassroots initiatives, but they struggle with the sustainability and integration. There are both financial problems and, let's say, awareness of the other people involved in the healthcare system. Example, in Spain, this organization AECC provides emotional and psychological support. In Luxembourg, the Think Pink support cancer patients. The barriers, as we have already mentioned, limited coordination, training, and also, unfortunately, geographic disparities. These were the people involved also in the second focus groups. So the recommendations: develop a national framework and legal recognition for social prescribing, increase funding for non-clinical services. Unfortunately, very often these activities are at the bottom of the list of the priorities of our policymakers. Training and awareness, standardized training for healthcare professionals, link workers, and volunteers. This is very important, and we are working on this. Raise public awareness about social prescribing. The collaboration is also to build, we need to build a cross-sector partnerships and digital infrastructure for referrals. Opportunity for improving the digitalization. We can create directories and platforms to map services. We need to leverage the European health data space for data-driven approaches. Pilot actions, test volunteering integration in cancer care, and we need to share knowledge, develop toolkits, we need policy templates and training programs. And this is one of the tasks of this international project. So as a conclusion, as takeaway message, social prescribing is fragmented, but has a significant potential. We need collaboration, awareness, and training, and these are really crucial. The next steps will be centralized information, pilot initiatives, and engage stakeholders. We need to focus on, especially on vulnerable groups like cancer survivors and the elderly population. And that's all for me. Okay, I will. And please, Juan, it's your turn. Yes.
I hope it is fine. Thank you very much, Ferdinando, for your wonderful presentation and update on different issues related to the project. I'm also going to go for an overview of what's been done up to now and the possible next steps on the project and how we see the structure and the possibilities this project is with us. A lot has been said already about the strengths and the good news on the project. And very good news is that we do have already a website that is quite updated already. Is space.eu.eu, and you have it here. So this quite, I said, updated, and the deliverables from the project, who are already going in time according to the schedule that I'm going to show you now, are being put here in the website very soon. So I recommend all of you to come regularly to here to see the updates and to try to see how things are moving in the project. So you will have all that through this website. And as already Joyce explained about this project and what the project is trying to see, is trying to aim, and is trying to focus. And so we do have a strength here on the need for fostering transnational collaboration in something that is becoming more and more on a day-to-day big issue, trying to know that, for instance, EU is very much interested at the moment in providing finance to projects who try to go into the social prescribing arena, because this is a collaborative model of something that is good, has been proven to be good for health of people. And so the social prescribing, even volunteering, is a remaining area of interest, because it's something that explore a concept that has been set, that is proven already a bit to be helping even more when talking about social prescribing. And we're going to go this to see in a minute. We're going to produce, as Joy explained, materials for that. And this is something that the project is going to work with and try to pilot these materials. And the main target people here, apart from the professionals who are going to be working, as usually in social prescribing from the health sector, will be the people who are going to be, at the end, the most benefit people, the people suffering from cancer, who will need rehabilitation. So it will be the target people on the project. As also Joy explained, the different partnership here, including different voluntary organizations and also different associations that are working on research, as in Barcelona, but we do have an association from Belgium who is coordinating. We do have also WONCA, mainly focused also on for GPs and their attitude and activity in primary care. But we do have an association from voluntary from Greece, another from Malta, another from Ireland, another from the UK. And we also have the European platform for rehabilitation based in Belgium. So these are the partnership, and with all these different characteristics of the partners, I think we're doing an excellent partnership because we're already participating in different activities together, and we're seeing how important is the collaboration when we are seeing the problems and the situations from the different angles. And so this is a win-win situation. And we do have different packages, what we call work packages in the project, from the work package 1, that is the project management, to the work package 4. And now we are just finishing the work package 2, just finished the setting the scene, in which we have coordinating all the situation on knowing how the situation is. And a lot of people have been participating. WONCA has collaborated a lot in providing the state of the art review on the scoping review, and all the partners have participated through their countries' information, how the situation is in every country. And apart from that, there has been a lot of working on different groups and focus groups with information we've just recruited, and it's going to be very, very useful. From then, we will move, and we're going to talk a bit soon about this, the capacity building, in which WONCA will have the lead from the special interest group on social prescribing and community orientation special interest group, trying to coordinate this task on the building of these training materials that is going to be used for the purpose of the project when we're going to be piloting the need of these patients with cancer for their rehabilitation on these urban spaces, garden urban spaces or green spaces for their benefit. And at the end, it's all the issue about communication and dissemination, who's coordinating from European Platform for Rehabilitation. So this is quite a comprehensive project. And the work package 2 have just finished, I said, with the information about the desk research and all these focus groups. And the state-of-the-art report was just finished and will be available in the website page I've just told you. And I want just to emphasize a bit about the survey on social prescribing that has been led by WONCA, and I'm going to show you some information now in a minute. We started anyway with the kick-off event in Barcelona on the last day of January this year, where we started the project knowing each other after starting online previously. And that was very relevant date. And from then, we've been working during these months on the different areas and settings in order to provide the necessary outcomes. This is the timeline of the project, where now we are the arrow marks at the end of starting after June, starting the summertime, where the work package 2 has finished, and there's the capacity building is starting, and all the projects with the communication and dissemination to the website and mass media also is working quite heavily at the moment. So this a long way until 2027, where the project will be finishing after 3 years, and we hope to get proper outcomes at the end and for the benefit of this patient that is going to provide this project, as we hope. This is a couple of images from the kickoff meeting in Barcelona, 31st of January this year, where it was participation from the different partnership, as well as from different stakeholders. We invited as well for participation and present experiences on social prescribing in different areas. And the aims for this work package 2, which is finished now, is to deepen the understanding the social prescribing through volunteering across Europe, and to establish a basis for that common approach involving voluntary. This is the novel aspect that we want to emphasize on our project. This is the partnership that was participating at the Barcelona meeting from the different organizations involved. That was already shown by Joyce. So we were happy to have all the partners in Barcelona, and some of the partnership represented by more than one people, two people concrete for a lot of them. And also these were the invited stakeholders from different associations who were provided also presentations and different explanation of their leading activities, and some of them very relevant on experiences, for instance, in EU projects related to involvement in social prescription of the Catalan Public Health Agency, who are now quite in collaboration with us in Barcelona and helping us in the development of this project and other ones, as well as IES Global, that is a leading research institution in EU projects, and who are already providing experiences in volunteering social prescribing in natural spaces. They have the Recetas project now, with a lot of good impacts for people having that kind of activities, and also the Time Bank network. So that was quite interesting outcome we had from that meeting. And also we moved then on during the next term on the focus groups. This is a picture of the focus group we held on the 13th of May in Barcelona, actually in the EDF health holders, and we have people here from stakeholders in Barcelona, from different voluntary associations, and from the health sector. So we didn't know some of them previously, but the exercise we've developed here was just great. And from that, we understood that this kind of project was very relevant to know what we do have, even at local level, but even what we do is that we can have and we don't have, and we are the problems and the possible solutions for that. So we achieved a very nice exercise, even with possibility to raise possibilities of escalation of difficulties, of wishes, or of attempts for achieving thresholds in the project. And that was because we developed like an activity in which we show the main solutions for problems and possibilities to solve them in a very, very nice way. So that was great. And from this project, the good as well, and that was also on other focus groups from different countries, was that they managed to get voluntary associations that were going to be involved, in the next steps of the project on site. So this is also a very good outcome from these focus groups, I would say, in all the different settings. So this is a good outcome as well from the focus groups. And this is what was the space survey like that was coordinated by WONCA from the WONCA Secretariat. And these were the questions. Sorry, it's a little bit small letter. I think you can read them. That were the questions that were asked for GEPs all around Europe, and some of the as well from out Europe. Have you ever heard about social prescribing? Do you agree there was a concept definition about social prescribing that most people agree with it? If people think social prescribing can be helpful, if it can be even helpful for people on cancer for their recovering, if everyone heard about what means green social prescribing, if people are involved in social prescribing in their own and routine daily activities, if it's easy for GPs to access these activities from their even local community services, if voluntaries are involved in everyone's country's experiences social prescribing, if you are or not interested in social prescribing, etc., etc. So there we are the main ones, and then if you wanted to be involved afterwards for other contacts, whatever. So that was the main survey, and these were the people from different countries who were answering. Yeah. So at the end, there were more than 552 responders for this survey. So it's a great number, and there were a lot of countries representation, not only from Europe, and as you have here on the right, on the bottom, also people from other countries out of the European region who were participating. And the good news is that there was good answering and good involvement in very few time. And I have to thank WONCA coordination for this and for the effort, and Harris provided a lot of support for this and from the coordination office to achieve this success. Some of the results from the survey, here are some just summary comments, is related to the awareness and understanding of social prescribing. Most of the respondents were familiar with that, what social prescribing means. There is agreement of the provided definition. There's also quite very high perception of the useful of social prescribing in the concept, even in the context of cancer recovery. There's an awareness, but this is just moderate, so it's still an important amount of GPs who have not heard about what means green social prescribing. There is also a moderate, depending on different areas. This is very variable on countries and situations about how they integrate social prescribing in their practices, and also about the access of community social prescribing services. This is very variable according to different countries. As well, very variable the voluntary involvement. But what was very common in most of participants is that they were all very interested, most of them, very strong feeling of being interested in social prescribing in their practices. The main principles for the space model development from what we have achieved on this state-of-the-art report and these months on based on research and seeing how things were at the moment and how we were trying to provide from that situation onwards. We can say that the principle for space is that we're talking about holistic prioritizing physical and psychological safety. This is something that a space model needs to be going through very, very seriously, going through that feeling of holistic, but prioritizing always thinking about the patients, their physical and psychological safety. Also, the empowerment. Empowerment is an important word, and a space trying to enable these patients on the transition from service recipients to voluntary contributors. So this is a transition also that tries to be solved in this project. Formalizing the peer support network within garden activities, where everyone is going to collaborate, from the link worker, or the person that is suffering from cancer, from the GP who's providing the prescription in practice, everyone, and trying to get that network working together. Also, the proactive inclusivity, avoiding barriers to send to cancer patients who should be benefit from an established already activity in the territory, in the community, who is going to provide that support. And then efficient and security healthcare integration. We do need everyone to be actor, to be involved in their needs and in their duties on a daily basis, and not only GPs who may, at the end achieve to have that recognition or that impact or even that commitment, but also that should be known from hospital and from the community actors as well. So everyone working together for the benefit of the patients. And next step now on the project will be trying to go for the capacity building. As already Joyce has explained, we are going to develop these materials to be useful for training participants at this space project. We are going also to search practices in the 5 participating countries to be piloting the intervention that's going to be in Greece, in Malta, in England, and in Ireland, and in Spain, and the intervention through volunteering on green social prescription. Let's then are going to be defining in every single setting what kind of green social prescription is going to be held. And the impact, as also has been explained, are going to be on the quality of life outcomes, as well as on the use of services, are going to be very useful outcomes that are going to be measuring the impact of this piloting intervention. And this is all from myself, just that you can follow us through our social media and our website, I already said. Thank you very much.
Great. Thanks very much for that.
Thank you. Any questions about the project, please ask. There's a lot to consider. There's a lot been going on with the project. We hope that you'll engage with maybe some of the information gathering, and also and with the website, and so that we keep it up to date. So, is there any other question? Any questions? But keep in touch.
Hello, could I ask a question, Joyce?
Okay, certainly.
So you mentioned, along with Ferdinando and Juan, that UK and Ireland it's quite popular in the UK and Ireland, social prescribing. Could you give us an idea of how the model works in the UK and Ireland, just so we have an idea of how it works there? Thank you.
In Ireland, apparently it's different between Ireland and England. They're really making a huge difference. But the representatives from Ireland are from the voluntary sector, so they're really pushing it. And it's the idea that when the people are volunteering, they're actually providing a service. So every time you're thinking about developing initiatives, you're thinking about what service is being provided. So, and not only do the patients benefit, but also it's thinking about what is specifically needed for them. And there's investment in link workers there, but also in the UK, there's been huge investment by government in the link workers, but not necessarily for the voluntary organisations that are providing the services. So it's something that needs to be considered. Yeah. I think Maria wants to ask a question. Is that all right?
Yes, hello everyone. It was very interesting hearing from all this project that is running all around Europe. I was wondering, I saw that from Greece, it is the Hellenic Cancer Federation that is a part of the project. And this is an ongoing problem with you mentioned healthcare integration and how primary care and hospitals and community can work together and help, especially cancer survivors and all those people that have multiple problems. And I was wondering if there is a project around this. I mean, how can we communicate better with oncologists and all these hospital treatments, and when the cancer survivors or anyone with cancer comes out to the community and primary care has to deal with this. I mean, Is there any pathway there, any projects there?
We're hoping to. One of the issues we're looking at is that's come up in the focus groups is that that in some countries cancer care is only provided in secondary care, and so we've got to. It's one of those things that we need to address is how to engage with oncologists as well. So in actual fact, a member of the group that did the scoping review is actually the lead for WONCA for cancer care and palliative care. So it's something that is going to be addressed, but also maybe link you also in with Katerina, who's leading for Greece, and thinking about some of the issues that you might want to feel should be included. Yeah, that's positive.
That's a very good idea, because that's the gap.
Yes. So but it's good that in a way that it's coming from there's voluntary organisations being proactive, but it's also one of the issues we've been focusing on that's come out is that interaction between the different organisations. And it's an important issue. Ferdinando wants to come in.
Yeah, yes, I want to comment and to give also a response to Maria. Hello, Maria. Actually, at the moment, we have perceived at the moment there is more awareness of the usefulness of social prescribing in primary care than in secondary care. In secondary care, there is still a lot of skepticism. And maybe this could be perceived as a provocation. I hope that they don't think that social prescribing activities are stealing money to their own sectors. But in a way, we should think that a lot of money is invested in these drugs for cancer that in many cases are not useful at all, while we could use this money for these social activities. I think that all people who work in primary care knows that yes, there are some fields that there have been big progress in terms of drugs very effective for cancer, but in other sectors, no. But still, we are using very, very expensive drugs for not having any success in this, for lung cancer, for other kind of cancers, no success at all. And we in the future we should also think that we could better allocate this money. In primary care, there is also another aspects that in many countries GPs face the problems of the frequent attenders, because for years we have medicalized social problems, and it is high time to reverse this situation, to deal with these patients with the social activities, not just with drugs or other kind of medical tools, medical activities.
Any more questions? And can I give Juan the last word?
Okay, yeah. Thank you very much for my last word. Really enjoyed this webinar. I think the topic is very relevant at the moment, but social prescribing will be more and more relevant in the years to come, because also, as Ferdinando have just said, the society has tried in trying to help people. We have medicalized a lot of issues that maybe have a better solution or better management in the community, where not only is a question of doing things nicely, but also are proven to have impact on people's health. So this is why from every time, more and more, the professionals in primary care and in hospitals as well, so have to take into account how relevant can be for a people, a specific person, to have a better outcome in the progression of their problems of health, not because of a drug, but also for the involvement of the community. And this is what a space project tries to address. The specific people suffering from cancer from the voluntary sector, with that intervention, get better in the future. And I'm sure we're going to manage this because that makes sense. And this is according to the evidence we've released. So just this message, and also with our colleague from Greece, great news, there's important interest from the oncologists. We also had an oncologist voluntary society group in the focus group in Barcelona. They're working together with a hospital oncology unit to try to make the best approach for patients. And that best approach sometimes means going into the nature for social prescribing activities. And this is what we're just trying to measure in the project. So good news for this, and also connect to your colleague in Greece, because she will be wonderful, happy to be with, to have you on board in the committees and in the network they are building in Greece for the project purposes. Thank you very much.
Okay. Thank you, everybody, for participating in this webinar. And I hope you've enjoyed it and will be engaged with it in the future. Thank you.
Thank you.
Thank you.
Bye-bye.
Bye.
Bye-bye.